Kirk has dropped by the studio to enlighten me and the rest of us on medical terms that I just don't understand, but I'm about to learn. Good morning, Dr. Kirk.
Good morning. How are you, Bob?
I'm doing fine. Okay, so here we go. We're talking about prenatal genetics testing.
What is that?
I don't know. I understand prenatal. That's like a baby before it's born. Genetics has to do with the makeup of our chromosomes and stuff like that, and testing would be checking out the levels of those things. That's the best I'm going to do all morning right there. Thanks, everyone.
Yeah, exactly. Thank you for coming. It's been a great show.
Thanks, Dr. Kirk. Appreciate it.
So we're talking about prenatal genetic testing, and this is something that's been going on for a number of years. Prenatal genetic testing has had a new wrinkle, a positive wrinkle, in the last couple years. So about 2012, 3 new companies came on board with a new technology. It's called cell-free fetal DNA. It's a nice term that is reflective of blood testing, and that's the only risk to this particular study. Blood testing of the woman who happens to be pregnant sometime after 10 weeks to allow us to get a sample of the baby's DNA. In other words, all of the genetic structure that baby has inside of her is floating around without a cell, just floating DNA in her bloodstream that's come from the placenta. It's very interesting. Now we've been able to figure out how to get that out of the blood and then study it and look for abnormalities. Abnormalities like Down syndrome.
Okay, wait. The mom's blood or the baby's blood?
You're
or
taking
it's all the same blood?
It's the same blood.
Still the same blood.
They're two different bloods, but you're pulling mom's blood out of her vein, just like you normally would with any test. In fact, I understand needles and you don't get along.
I don't care for the needles. They make me fall down.
That's why we're doing radio, so I won't show all the people how.
Thank you.
Okay. But you take the blood just like you would any other blood test, and that then gets spun down, and there's a sequence of events that the testing companies have developed that look at millions and millions of copies of the DNA that are inside. And about anywhere from 3 to 13% of the blood has fetal DNA in it, of the mother's blood. So they can extract that from it because it's different weight. It doesn't have any cells, so it weighs a lot less than the blood cells.
So when you spin it, it's like oil in water. The heavier goes to the bottom, the lighter goes to the top.
Exactly. And they can extract that, and then they apply these testing mechanisms to it that literally over several days perform millions of tests, millions of DNA samplings. And through algorithms and through this process, they can actually extract, are there abnormal chromosomes present? The problem, of course, they can't do everything. They can't look at all the problems that are genetically available or possible to patients, but they can find the most common ones. So, what are those?
Down syndrome.
Down syndrome, right? Or Turner syndrome. Do you know what that is?
Now, what's Turner?
Now, Turner syndrome is when a woman who normally has 2 X chromosomes, one from the man and one from the woman, normally has 2, but a Turner's patient has 1 X chromosome, and they're missing the other chromosome. So they end up having challenges. Some of them are perfectly normal in terms of their mentality or their intellect, and others don't. They have problems with intelligence. But most commonly, they have short necks, short stature, they're infertile. They definitely have an appearance that's very different than what we normally would see with 2 X chromosomes. It's very common. Turner syndrome is one of the most common abnormalities in general, but most of the pregnancies that pass, whole other topic, spontaneous abortions, when pregnancies are lost, which is obviously a very sad topic, and we're only talking about happy things here. But when that happens, the most common problem is Turner syndrome. It's missing an X chromosome.
And so the body knows it, so it goes, let's not do this?
That's right. That's
in
right.
layman's terms.
That's exactly right. So the other things that we look for are everything has a name. So there's the Patau's syndrome, which is trisomy 13. Long words. Trisomy means an extra copy. There's 1 extra copy of the 13th chromosome. And that's the same thing of Down syndrome. Down syndrome is trisomy 21. So there's 1 extra copy of the 21st chromosome. There's another one called Edwards, which is fairly common as well. About 1 in 5,000 births have this particular problem. And that's trisomy 18 or Edwards syndrome. There's even a thing called Klinefelter's. Have you ever heard of Klinefelter's?
Only when you said it.
Ah, yes, Klinefelter's. It's a great name. Like you said,
it reminds me of Seinfeld.
Exactly. And it kind of is. It's very interesting. Klinefelter's, they have an extra Y chromosome. They have 3 chromosomes for their sex chromosomes. So they're X, Y, Y. Not so much. Now, most of the time, they're a little bit less in terms of the intelligence scale, like IQs are slightly lower. But they're tall. They may even be handsome. But they end up
Which
in
could
jail.
be good.
They end up in jail, though.
That's bad.
Yeah, we don't know why, but they're more aggressive. And when you sample the patients in the world and then compare them to the patients who are in the jail,
Right.
males, there's a significant preponderance of men who are tall, who are in jail, who happen to have Klinefelter syndrome. Very interesting.
That is interesting. At some point, are we going to be able to test people before they're born to figure out what their predispositioned kind of to be?
That is exactly what we're talking about here, and that's exactly what's coming by. See, you don't need us docs to come. You get it. That's exactly what we're talking about.
No, I need you to explain it to me so that I can grasp 30% of it. That's all.
Seriously, that is exactly what this is. So we're taking out the cells from a mom to look for all of these problems. Trisomy 13, trisomy 21, Down syndrome, trisomy 18, the problems with Klinefelters, any XY chromosome abnormalities. And we can actually test that before the pregnancy continues. We can even test it before the pregnancy exists. We can test the genes in each of the parents before we actually have a baby.
Before conception, you can
Absolutely.
already figure out.
You can. If you know what runs in the family, you can test for it. The long and short of it, though, is this particular test is special because, number one, it's non-invasive. Unlike
You don't go in the womb at all.
Right.
You just
You're
get
not
in mom's arm and take some blood.
exactly the other needles that we're not so fond of, they end up potentially causing problems. You know, the risks of prenatal testing, and prenatal testing is a big area where, you know, those of you out there in the audience who have had pregnancies and partners with pregnancies, you know that you're offered prenatal testing in the first trimester. We think of the pregnancy as 3 trimesters, 40 weeks long. Each are about 14 weeks, plus or minus 13 to 14 weeks. And in the first trimester, we have blood testing and an ultrasound that we do. And then in the second trimester, more blood testing. And we put all that together and we calculate risks as to what the risk is for Down syndrome or trisomy 18 or other problems like neural tube defects. Have you heard of spina bifida?
Yes.
Right. Spina bifida is a neural tube defect where the back simply doesn't close. It's why every woman who's pregnant, anybody out there who's pregnant who's not doing it, folic acid. Folic acid, it's one of the vitamin B's. Great stuff. Got to have it, especially before you get pregnant. That being said,
Vitamin B is good.
Vitamin B is good. That being said, more is not better, though. Just the amount you need. Don't take too much of
Everything
anything.
in moderation.
That's right. That's right. That's what our mom said. So, long story short, if you're trying to get a testing for these genetic abnormalities, the historical testings, the one I just described, first trimester, second trimester, these have the primary risk of emotional risk. It's the risk of having a positive test that's not positive, a false positive test. And it's a very high risk. In
Which
fact,
would be scary, yeah.
well, it is. It's very anxiety provoking for women, right?
Right.
For husbands, wives, partners, very much so, because most of the test results that come out, most of them are false positive.
That
so-
would be like getting a false positive AIDS test and going,
Not good, right?
Not
Not
good.
good. I mean, people would kill themselves sometimes
they
over that kind of
could,
stuff, right? Right?
freak out.
Now, this is a similar type of thing. The reason why this is so spectacular, this new test,
Right.
And understand, it isn't ready for prime time for everybody, and there are reasons about that we can talk about. But at the end of the day, the false positive risk is about 0.5%. It's not 75% or 50%.
No, we can
where
deal
it
with
can
one
be
half of
depending on the age,
1%.
right? Exactly. So the majority of the tests are reliable. The sensitivity, if those of you out there who love statistics, I don't understand you, but statistics being what it is, they actually do things. And when you look at sensitivity and specificity, these are two important parts of tests. They're going to tell you if I test positive on something, it really is positive. That means it's specific for that disease.
Right.
Or is it sensitive? If I actually have the disease or if my baby has Down syndrome and I test that, I'm going to pick it up. That's sensitive. Well, this test has amazing specificity and sensitivity, 98, 99 plus percent. Some of the tests are 99.9%. It's just as good, almost, as doing an amniocentesis and a CVS, chorionic villi sampling. Have you heard of those things?
No, but they scare the heck out of me.
They're needles.
See, I knew they were scary. Right there. There's
Intrinsic.
needles involved, and you're messing with the fetus, aren't you?
Well, you aren't directly in theory. But
Are you in the womb?
You are. You're either in the womb pulling fluid out, the
That's
amniotic
it.
fluid.
Very near the fetus.
That very near. And that's what causes the problems. The baby can move and get stabbed by the needle.
Bad.
Not good. Or you get a little sample out of the placenta. When you take a sample from the placenta, that's called a chorionic villi sampling. And they're wonderfully accurate tests. They're still not perfect. But those are the diagnostic tests that tell you if you have a positive test on this